and welcome to Health Curious Episode 1. Today, I'm speaking with Miss Tiffany from Baltimore, Maryland. Tell me a little bit about yourself.
So my name is Tiffany Jones. I work in the state of Maryland, also live in Baltimore City. I'm married. I've got 2 stepchildren and a frisky German Shepherd.
So what has your experience been like dealing with doctor's appointments, hospital trips, healthcare-related issues, etc.?
So I feel pretty lucky. I work for the state of Maryland, so I've got state of Maryland insurance, which is known to be really good insurance. I don't find that there's any difficulty finding doctors, making appointments, and living in an urban city like Baltimore City really affords us a plethora of hospitals that we could really choose from, and all those hospitals have specialties. So if you ever run into an issue or need a specialty service, it's not difficult to find within 20 minutes of any place. I have friends who don't have really great health insurance or who live much further out, not near a city or an urban place, and they really struggle to find good doctors, what they perceive to be good hospitals and good appointments without traveling more than an hour away. I oftentimes will bump into people who will travel in excess of 2 hours to get to a St. Agnes, a Johns Hopkins, a Mercy Hospital, some of the local hospitals here in Baltimore.
What medical experience, good or bad, has impacted you the most?
Probably the one that's more long-term and lasting has been getting a hysterectomy. I, like a lot of women that are African-American, deal with fibroids. So there are these growths sort of in your oval lower region, early parts, and they're pretty prominent for some reason in African-American women. My mother had them. I had them. I'm sure all of my female cousins have them. And the course to treat them if they're really painful is to get a hysterectomy or partial hysterectomy. For about a year and a half, my doctor had no idea what they were or what I had. And I would routinely have a lot of abdominal pain, then have to leave work and immediately go to him. So after about a year and a half and experienced pain coming to his office, he said to me, "Oh, you have fibroids and they're pretty big. You need to decide now if you want to have children." I think I was probably 23. I was shocked, surprised, dumbfounded. I had no idea what a fibroid was. He had at least been my doctor for 5 years. And so he would have seen the growth happen over time where he completely dismissed it. And he was a pretty renowned doctor. It was a shocking way to find something. He didn't leave me with any information. He just told a 20-some-year-old woman who had constant pain that I needed to decide then if I wanted to have children. And it was shocking. I switched doctors and found a Black doctor that's in Howard County. So that's probably about maybe 30 minutes from where I am. And we went on to form a really good patient relationship. She did my procedure and I had a partial hysterectomy and then sort of like a fuller one. They just, once you take them out, they seem to come back again, you know. And I think that's probably been it. So, yeah. The second surgery was really complicated because of the first surgery, and it caused my bowels to kind of stick to one another. And so, in addition to having a pretty big abdominal surgery, they had to reconstruct my bowels. It was really weird. So, my surgery took much longer, instead of being in the hospital for 48 hours and for about a week. And that was best case scenario, seeing a specialist because there were a ton of them. That's probably the biggest medical issue I've had to date, knock on wood. I hope that's the worst and it's behind me.
Would you say it's a little unnerving considering that this was your doctor, your first doctor, and wasn't able to not only, if he did know, communicate, but even think of it as a possibility when he knew you were clearly in pain?
Yeah. I never spoke to him again. I actually left his office in tears. I was just young. It was a flood of emotions and a void of any sort of education. And it made me really rethink who's a good doctor. He was very popular. He was very funny. He was really approachable. By the time I needed him to be a really good doctor. He wasn't at all. There's no way that he was an OBGYN and would not have any idea what a fibro was, especially over more than a year of time. My surgery would have been lessened. So many things could have been averted had he been aware. And I don't know if it's because he didn't have a lot of African American patients and he just wasn't aware. But maybe the onus was on me to go back to tell him that that was crappy. You should know better. I would expect you, after being my doctor for 5 years and having at least two annual visits a year, I was really, dogged about my healthcare, that he should have been able to spot that. And when he did, the approach and delivery was just lacking at best.
Yeah, I agree. How was the experience in total, first with this doctor and then the many surgeries after? How has this experience impacted you?
You know what? I do a lot of information sharing. I think there's a term the kids call like kind of gatekeeping, where you have all this information, you keep it to yourself. So if I see a woman that's my age or younger and she has any indication or signs that I think she may be going through anything, I always go find a doctor. And if you don't like what they say, get a second opinion, get a third opinion. Everyone that's labeled the best doctor isn't. Find someone that works for you.
After all of this, what areas of growth do you think should be implemented?
I think the whole healthcare system should be scrapped. Schools teach doctors a certain kind of way, and I think very few of them include alternative care. I think there are a lot of ways that people could get better healthcare that isn't necessarily prescription based. I think when your doctor always tells you, oh, lose 15 pounds, everything will go away. I think they should give you sort of a plan for that. I do find I have one doctor that does that. He's like, I want you to get to lose it at. I want you to set a goal of this a week. If you can do that and this and that, when you see me in 6 months, your goal, you'll look like this. You'll be like this. Your numbers will go down. Will this go up? I feel like doctors kind of overprescribe. I think they undertreat. They seem to give you sort of short-term remedies that don't really lead to long and lasting healthcare. And I think that's probably what's missing. Yeah. I think it's hard to kind of hunt and pack and find a doctor that's going to be a good fit for what your needs are and to kind of align that together so you're getting optimum health.
Yeah.
I wish doctors would talk to patients more often. You know, I've got some strong thoughts about doctors and the healthcare system, but I also think it's on the onus of the patient to not walk out until they're really clear about what's what. So I will, I don't think that doctors should be magician and mind readers and be able to necessarily articulate everything to everyone. Sometimes it takes a minute for you to absorb it. You need to be in a different space to understand exactly what was said. It's all going to come out in medical jargon, and they need to be able to allow you the space or the education to be able to digest it and then figure out what that means to you personally. So I will say, I think the patient has to have the onus of not having the sort of complex for doctors and saying, if they said it, it's true. It doesn't feel right, get a second opinion. If you do some independent research, take your time and do it. Don't commit to anything too soon. Have a list. I don't go to doctor's office unless I have notes on my phone about what 3 things I want to do. And I keep it to 3. Anything beyond that, I'm probably going beyond my 15 slotted minutes. And stop overbooking. I think it causes anxiety for people. And it's not just the time vault, which is horrible, but I think people just kind of grow and get this sort of white coat complex and have growing anxiety and are just at that point just ready to get in and get out. I think that's a deficit in helping them really spend quality time with their doctor. And like, I got to go back to work. My bus is coming, whatever it is. If you have an 11:30 appointment and it's 12:40 before you even seen, and you get a good 15 minutes, both of you are probably just kind of checking the minimum thing off and get out. But it's your health and it's your life. And it should be worth more than 15 minutes. And if that's all it is, then you should say, we'll use the first 5 minutes to answer Q&As. I'm going to do a quick evaluation of your vitals, and then we'll do a quick follow-up. If it takes more than that, that's fine, but that's what you have scheduled. I wish doctors would be more upfront about that so you know exactly what you need to do and you can prioritize your time with your healthcare physician. And it's not always easy, but I think that's their responsibility.
What advice would you give others who may have experienced the same things as you have?
Find a healthcare provider that is a good fit for your healthcare journey and don't be afraid to change. The doctor I had in my 20s is not the one I needed in my 40s. I think people just have to be smart about what they do. They need to proactively plan. It's so much easier, I would imagine, to treat something to prevent it versus try to treat it. Be proactive about your healthcare.
Bouncing off of what you said before about having different doctors, who's
Okay.
your doctor now, and what criteria went into choosing them?
I need a doctor who is interested in well being. The other doctor I have now is the one who will sit down. He's great with being able to leave. You can ask him a question and notes so you get his attention without having to book an appointment. I love being able to do that. He gives you an action plan versus a prescription, and that's the difference. And then he holds you to it. So there's a strong bit of accountability there. So in my mind, he's a good doctor.
Yeah, and it makes sense because he's promoting your future healthcare. You know what I mean?
Mm-hmm.
Like
Yeah.
he's doing it for your better future, not just to treat the problem at hand, but like so there
Yes.
aren't any problems at hand.
Yes, he really is great about kind of giving you a good action plan. And that's the first thing that he follows up with. So when you were with me last, we had a goal to do A, B, C. Let's get your numbers, see where you are, and see what we need to do to tweak it. So, like and that's the kind of healthcare provider I think everybody should have, but not what everyone wants.
Thank you so much. I really appreciate it.
I appreciate being here. This is great. Good luck to you.
Thank you. That segment, which you just listened to, was my interview with Miss Tiffany. Hearing her speak about the challenges she faces as an African American woman in the United States healthcare system, which, may I add, is predominantly white, as it pertains to her hysterectomy, was very insightful. I also found her opinion on overprescribing and being your own health advocate to be important takeaways. Overall, I felt that this interview was a very important representation of the types of themes we are going to be talking about on this podcast. I would like to thank Miss Tiffany so deeply for allowing me to share her story. Thank you for listening to Health Curious. If you'd like to subscribe, you can do so on Spotify or YouTube. I hope you'll join me again soon.